Morning. We're very pleased to welcome you to the new campus of the CUNY School of Public Health, and to introduce you to the first event of the New York City Food Policy Center here at our 125th Street campus. Is this echo still going on?
You're reverberating.
Maybe we'll try this. I've never been criticized for having too soft a voice. Some of you may have heard in the last few weeks the CUNY School of Public Health has been restructured and is now a separate CUNY unit that brings together the campuses of Hunter, Brooklyn, Lehman, and the Graduate Center here. Eventually we'll be moving into this building, and we look forward to maintaining our commitments to our degree programs. We look forward to featuring our work on food policy here in New York City and other cities. And before I introduce our guest speaker, I just wanted to introduce the Dean of the School of Public Health, Dr. Ayman El-Mohandes, to say a quick hello.
Until somebody older and wiser shows up and fixes this echo thing, let me, no pun intended, echo Nick's remarks. You're welcome here. This is a space at CUNY that is going to be dedicated for public health dialogue today and the future, as the only public school of public health. We identify ourselves as a relevant contributor to the health of the residents of New York City, the nation, and the world. We hope that you understand that you own this space. And Nick is a perfect example of our representative in the community that brings together people with public concerns, people with joint energy, people with new thinking, people with leadership, as Marion has demonstrated over many, many, many years. We couldn't have a better person to be our inaugural speaker, because she brings with her goodwill, but also fierce advocacy. Public health today is challenged by a lot of political and economic variables that don't always place the public as a priority, and have a very proximal understanding of outcomes. And we, together, with a deeper understanding of how we are going to impact the future of this nation, need to put our energies together, our intelligence together, our advocacy together, and propagate the right messaging. This messaging needs to be evidence-based at many, many layers, not just the academic and scientific layer, but also the applied science layer. And there is no one better to represent the application of what we know about industry and its interface with the health of the public than Marion. So I welcome you here today. I'm very, very proud that Nick chose to have you as our first speaker in this space. And again, please come back. Consider this your space. We are just holding it for you. And hopefully we can do a lot of good work together. So welcome again.
We are particularly pleased to have this talk in this place because in the poor and Black and Latino communities of New York City, we've experienced a very heavy burden of diet-related diseases. And exploring public health is not an armchair discipline. It's a discipline that looks to understand dynamics in order to take action. And what better way to do that than to understand the role of the soda industry in producing health and disease here in Upper Manhattan, in Harlem, in East Harlem, in New York City, the nation, and of course the world. The book is Soda Politics. It continues Marion's long tradition of providing the evidence that fierce advocates with goodwill need to bring their messages forward. And we really welcome her to talk. The format for today's session is Marion is going to talk for about 40 minutes or so, and then we're going to have plenty of time for back and forth questions. And just in case you were wondering, the book is available at Barnes & Noble, Oxford Press, Amazon, and elsewhere. Marion.
So what's the, I see what the microphone situation is. Thank you all for coming. It was an adventure to get here for a lot of us who aren't uptown very much. But thank you very much for inviting me and for letting me talk about my book here. I like to start by talking about why I wrote a 500-page book about soda and soda politics. And I think the reasons are pretty simple, although there are several of them. This is really a book about advocacy. I teach food politics, food policy, and food advocacy at NYU. I've been doing that for quite a long time. And I needed a book to use in my food advocacy class. I thought I might as well write one. And I'm indicating, I titled the book, Taking on Big Soda and Winning. And the parenthetical and winning is something that I really want to emphasize because I think there's a lot that's going on in advocacy around soda issues that's working really well. And I want to emphasize that. And so I've put these little thumbs up buttons on all of the places where I think we're making real progress. I want to start by saying that one of the questions that I get asked constantly is, what does soda have to do with politics? And I can answer that in one slide. So I'll just leave that. That was in Moscow in 1995. The soda industry is a worldwide industry, very, very deeply entrenched in developing countries. And there is an enormous amount of advocacy to try to encourage people to drink less soda. Many, many different organizations in many different places. So there's plenty to write about. So that was another reason for doing this. And then in public health terms, the sodas are low-hanging fruit. They're really, really an easy target. And the reason that they're an easy target is because they contain sugars, water, and flavor, and nothing else of redeeming nutritional value. And for a product like this, it's really simple. You shouldn't eat a lot of sugar. It's really, really simple. And so that makes them a very easy target as opposed to fast food and other kinds of food which are high in calories but have nutritional value. Sodas have no nutritional value. Low-hanging fruit. Now, the amount of sugar in sodas is staggering. And even though I've been I worked on this book for 3 years, I still cannot get my head around how much sugar there is in sugar-sweetened beverages. And the way I finally had to just memorize it. It's 5/6 of a teaspoon per ounce in a standard sugar-sweetened beverage. And so it's a little bit less than a teaspoon per ounce. What that means is if you've got a 12-ounce soda, you've got 10 full teaspoons of sugar. That means you're taking 10 sugar cubes and putting them in, or you're taking 10 packets of sugar. You would never take a glass of water and put that much sugar in water. And yet, because of the way the flavors are balanced, somehow the soda industry has made it possible for us to drink an enormous amount of sugar. What Center for Science and the Public Interest started calling liquid candy some years ago. You would never let your kids eat candy all day long, or at least most of us wouldn't, or we wouldn't eat candy all day long. And yet somehow the soda industry has convinced us that it's okay to drink liquid candy all day long and not consider the consequences. And there are consequences. Now, we know from the dietary guidelines what it is we're supposed to be eating. And the 2015 dietary guidelines were rumored to be coming out last week. They didn't. So now they're going to be rumored to be coming out this week. They're coming out any day if they come out. And I suspect that they will say exactly the same thing as the 2010 dietary guidelines. We're supposed to be eating more fruits and vegetables, lean meats and dairy products, and a lot less junk food and soda. So we know what it is we're supposed to do, and the reason for that has to do with the fact that sodas are among the top sources of calories in American diets. This slide you have to read from right to left. According to the dietary guidelines in 2010, the single largest source of calories in American diets were what the Department of Agriculture loves to call grain-based desserts. Which is their ridiculous name for pies, cookies, Pop-Tarts, donuts, and all of those things that we love eating. And that, because everybody eats those and because so many people eat them, they turn out to be the largest source of calories. Bread is next, fried chicken is next, and sodas is the number 4 source of calories in United States diets, greater than pizza, which I find very hard to believe. But that was what the data showed. And then there's alcohol. We won't talk about alcohol. The amount of soda that Americans drink is also pretty staggering. This slide goes from 1980 to the present day, and it's the quantities are given in gallons per capita. Now, let me explain that per capita means men, women, old people, little tiny babies. It's across the entire population. And in its peak year, it was a little bit more than 50 gallons per capita per year in the United States, a staggering amount. Since the late 1990s, the amount of soda that people have been drinking per capita has gone down. And it's gone down substantially, so that it's now roughly 35 gallons per capita of of total beverages, and of those about 30 is the sugar sweetened kind and about 10 or less is diet kind. I'm not going to say too much about diet sodas, but I'll say some things about them. And the thumbs up there is because people are drinking less soda and have been drinking less soda for about 15 years. And believe me, the soda industry is very aware of this. I'm not going to say much about diet soda because it doesn't have sugar in it, but just to show you what's happening with diet soda, all low-calorie sodas are also decreasing in consumption. People are not drinking them as much. They're going down since about 2005, which was around the peak year, and that has to do with increasing public distrust of the chemicals that are in diet soda. I don't particularly like the taste of them. They have this bitter aftertaste, but people are very worried about chemicals in food these days, and so sales of those are down too. And so the soda industry also has to confront that. Now, not everybody drinks soda. If you're like me, you're one of the 50% of the American population that never drinks sugar-sweetened beverages. About 25% of the population drinks between 0 and 1 12-ounce can of soda a day. 20% drinks between 1 and 4, and 5% of the population drinks more than 4 cans a day. And certainly there are people who buy sodas by the liter and just carry it around with them all day long and sip on it constantly. But half the population doesn't drink any at all. And that means that all of the figures on consumption amounts have to be doubled for the half of the population that does drink soda. So if the average consumption for the entire population is one 12-ounce can a day, which is what it is, but half the population doesn't drink any, then the average consumption for the half of the population that does drink soda is 2 cans a day or more, which is really quite a lot. That's 20 teaspoons of sugar right there. Now, that wouldn't be a problem if sugar consumption and soda consumption wasn't highly correlated with obesity and other health consequences. And much of the evidence that links soda to obesity and health consequences is correlational. And here's one of the correlations. These are maps that just came out about the global prevalence of obesity, overweight and obesity. The darker the color, the greater the prevalence, and global soft drink consumption. And these maps are not strictly superimposable, but they're highly correlated. Countries that where the population drinks the most soda tend to have the highest prevalence of obesity and vice versa. And there are many areas of the world where there's a great deal of obesity, but there's not much soda consumption. But in general, it's pretty highly correlated. And in fact, if you look at the United States figures, the increase in the overall consumption of soda on a per capita basis between 1980 and 2000 was highly correlated with the rise in obesity during that period. And then since the decrease in soda consumption, since about 2000, obesity levels have more or less leveled off a little bit, as shown here. And I've got a thumbs up on that with a question mark on it, because the most recent figures on obesity in the United States are a little bit difficult to interpret. They show an increase, the upper curve here shows an increase in the prevalence of obesity from 2011 to 2012 to 2013 to 2014. There was a rise from 34.9% of the population to 37.7% of the population, but that was not statistically significant. And I wish that I could find a curve that had error bars on it. If you saw the error bars, you would see that they overlap. And so we don't really know whether obesity rates in adults are going up or are staying about the same. And we won't know until the same survey whether the trend is upward or flat. But it's certainly flat for childhood obesity. So that one gets a big thumbs up because that's a big change. The increase in the prevalence of obesity in childhood was increasing quite a lot until the early 2000s, and now it seems to be leveling off. So that's progress. And the soda consumption is also highly correlated with other conditions. According to any number of studies, if you drink just one soda a day, and that means 12 ounces, it increases the risk of heart disease in men by 20%, increases the risk of diabetes in women by 25%, and for everybody it increases the risk of overweight by 27%, so that's pretty highly correlated, and it increases the risk of stroke by 16%. Now, these are again correlational, and you don't know whether this is causation or whether soda drinking is a marker for other kinds of unhealthful dietary practices. But more and more research is pointing to the fact that soda comes up over and over and over again as something that is highly correlated with an increased risk of disease. And that was the basis of a whole lot of public health advocacy campaigns. The one on the right happens to come from Los Angeles, which kind of copied what New York City had done. You wouldn't eat 22 packs of sugar. Why are you drinking them? Making the point that you shouldn't be drinking your sugar calories. And then we get to advocacy. And I have a thumbs up for advocacy because advocates have picked on these correlations between soda consumption and public health problems. And initiated enormous numbers of advocacy campaigns focused on trying to help people drink less soda and get sugar-sweetened beverages out of their lives. Now, I mentioned earlier that the soda industry is well aware of this, and believe me, they've been aware of it for a very long time. I first came across this in 2007 when the marketing director of Coca-Cola North America gave an interview to Advertising Age in which she said, "Our Achilles heel is obesity. It's just killing us." It used to be that we could just blame obesity on personal responsibility. We're not holding a gun up to your head forcing you to drink sodas. If you drink sodas, it's your choice. And now they can't do that anymore. And already by 2007, they were complaining that their marketing was up against the anti-soda advocacy, and it had become an enormous issue for them. And actually, if you go back and do the research and look at Coca-Cola's filings with the Securities and Exchange Commission, Coca-Cola, like every other publicly traded corporation, is required by law to file with the Securities and Exchange Commission an annual report, which they do at the end of December. And since 2003, so for 12 years now, Coca-Cola has listed as the single leading threat to company profits obesity and its consequences. So this was the one from 2014. The number one risk factor, obesity concerns may reduce demand for some of our products. They aren't kidding. Researchers, health advocates, dietary guidelines suggest that people would be healthier if they drank less sodas. This is tough for our marketing department to deal with. So they are well aware of the problem, and we'll talk about what they do about it. So one of the things that has happened is that the soda industry has come under increased scrutiny, and this somewhat offensive cover, good heavens, what is it doing? What did that do? Did it just turn around? Weird. Anyway, this is Bloomberg Business Week. Thumbs up on that. The business press is taking a really good hard look at the soda industry to try to, and examining what it is doing to try to keep its profits up, because that's all the business press cares about. There is also more scrutiny about other practices of the soda industry, one of which is marketing to children. The soda industry has voluntarily said that it will not market to children under the age of 12 on television, on children's television programs, but every evaluation and investigation of the soda industry's marketing practices has shown that it gets to children in lots and lots of other ways, as this report from the Rudd Center showed a couple of years ago. There is also increased scrutiny about the soda industry's relationship with minority communities. And this is a long, long story. I have a chapter in the book called Marketing to African Americans and Hispanics, and it's subtitled A Complicated Story, because it is a complicated story. The history of it goes back more than 50 years, 50 or 60 years ago, when minority communities demanded that the soda industry advertise to them, advertise in their publications, and hire minority employees as part of their effort. Martin Luther King, on the night before he was assassinated, gave a speech in which he exhorted his followers to boycott Coca-Cola, not because Coca-Cola was marketing to the African American community and making everybody fat and sick, but because the Coca-Cola was not advertising to the minority community and not hiring African Americans. So obviously things have changed, and obesity changed that. So there's a very long history of this, and these are some examples of soda company marketing to African Americans. the soda industry now uses minorities to fight tax campaigns and other public health campaigns. This was a billboard from the Richmond, California soda tax campaign of 2012, in which people from the community pointed out that the tax was unfair and regressive, and it hit poor and working people the hardest, and urged people to vote no, which people in Richmond did. And then here's the Apollo Theater, which Nick just told me that it's still there, but this photo was given to me in November. Here's the Apollo Theater thanking Coca-Cola for its support of the Apollo and the minority and the community around here in Harlem. We also saw this in New York City during Mayor Bloomberg's ill-fated soda cap campaign, in which the many representative organizations representing the African American and Hispanic communities sided with the soda industry against the soda cap initiative, and the New York Times pointed out that these were the very communities hit hardest by obesity and its consequences. And as I said, this has a long history, and the explanation is that the relationship with the soda companies benefited some members of the community, but not others. And so there's a great deal of advocacy against soda consumption in minority communities now.